Hi, this is Danielle from Soulhakker, and I'm here with Jerry Simon's PA, and he is one of the most respected clinicians in the world of Lyme disease and complex chronic illness. He's had decades of experience alongside treating patients that others just couldn't figure out. He worked with Lyme pioneer physician Joseph Burrascano. He's also known for connecting the dots in a multi-system illness using integrative root cause approach. And many consider him, or I consider you, like a real life Dr. House. He, Jerry blends deep clinical insights with unconventional thinking to solve the toughest cases. And I know this firsthand, just a little bit of background. Jerry and I met 20 years ago, because that's when I was working with Dr. Morrison. I started working on Park Avenue South in that clinic. And Jerry was practicing there and working with all these people with Lyme disease. And I did not have Lyme at the time. I, of course, knew what it was, but I wasn't that familiar. And I was looking at these people coming in with all these symptoms. And it wasn't until years later, I was later working with Oz Garcia in another practice, and I started coming down with mystery symptoms that no one could figure out. And this is like 13 years later or something. And I said, I have to go to Jerry. And
Mhm.
that's how I ended up coming back to you. And we reconnected. So you're very busy, and I really appreciate you taking the time to speak with me. I'm sure a lot of people want to hear from you.
Danielle, I'm excited to be here. We've been trying to pull this off for months, if
Yeah,
longer. You know what I mean? And congratulations on everything you've been doing in the wellness space. I know how many people you've helped and how many depend on you. So I'm excited to be here.
thank
So,
you.
mhm.
So, a question is, when people don't understand chronic illness or especially Lyme disease, why is it that so many people just don't recover?
Right. So really interesting. Like if you're watching this and you're like kind of feeling like lost and alone and directionless, especially dealing with anything related to tick bites, for example, we know that just how complicated all of these different diseases actually are. So, for example, if you get a tick bite, we know that Lyme disease can come in many different forms. Probably the name most of you know of is something called Borrelia burgdorferi, which is the Lyme bacteria.
Yeah.
You also know you could have Borrelia burgdorferi and have a numb face, Bell's palsy, or you could have Borrelia burgdorferi and have knee pain, or you could have it with the flu, or you could have Dr. Fallon published on this, millions of people studied from Columbia, psychiatric presentations. Now, Borrelia burgdorferi is just one germ. Remember, if you look up Lyme disease on the Mayo Clinic website, they
Mhm.
talk about Borrelia burgdorferi, Borrelia mayoni, Borrelia afzelii, and I think it's Borrelia garninii.
I'm
So
laughing because his name sounds so like complex. Yeah.
yes. So, everybody, if you're taking notes, hopefully you've started taking notes already. There are many different strains of Lyme disease, and
Yeah.
many people come to me. I'm like, oh, you've had a test for Borrelia burgdorferi. But the way your symptoms come and go, especially with like a fever, I'm thinking that you might have Borrelia miyamotoi,
Mm.
which we originally called relapsing fever. So, Danielle, back to answer your original question, you can get Lyme disease in many different forms, and you might require several different types of treatment. What about that person that has a headache and joint pain? For
Right.
example, doxycycline may work for them, but then they come back and they may need a different type of treatment for that other strain, right? So,
Right. But also the doxy could work better if they catch it immediately and they take the doxy rather than it be lingering and 6 months or
yes.
later and it's chronic, right?
Right, exactly. That's kind of the second half of your why am I not better question.
Mhm.
The first is maybe we're missing one of these multitude of Lyme germs, and we'll probably talk later about the different co-infections. But the other part is that early detection. I try to teach when I speak to doctors and PAs and nurses, veterinarians, especially in Lyme endemic areas, if you see someone with a flu, have a very low threshold for addressing Lyme disease early. We
Right.
now know there's a lot of data that says only about 70% of people may actually get that characteristic rash. And what if that rash is in your hair? If it's behind your knee, in your butt crack, you may never even see the rash.
I never saw it. I mean, this happens all the time. People think you have to have that bullseye rash, and it's so misleading, and then we never check. I mean, I worked in a clinic, one of the top clinics in New York City, and it didn't occur to me Lyme disease, right? When I was
Right.
having all my symptoms, because I didn't see anything. I don't remember no tick, no bullseye rash, nothing.
Right, right, exactly.
Yeah.
Now, get a load of this story. We know through climate change, warmer springs, warmer falls, more humidity. People, ticks love humidity. Don't walk on wet grass. Stay
Right.
out of the moisture. But this climate change is pushing Lyme disease 4 kilometers deeper into Canada, basically every year. There are towns and areas in Canada that have never seen Lyme disease, and they're just starting to learn about what to do with all of that. Now, get a load of this. This has become such a problem that in Canada, they're trying to figure out how to manage this kind of growing epidemic of Lyme disease. And actually, in Nova Scotia, this was just published last year. In Nova Scotia, they actually passed a law allowing pharmacists to prescribe doxycycline for people
Wow.
that come in and say they have a tick bite. Wow. Now, get a load of this. The data published, it was in the Sage Journal. Maybe we'll add references to the end of this.
Okay.
Last year, 2025, did you know 60 or 61% of all doxycycline prescribed in Nova Scotia was by pharmacists? Really
Wow.
interesting.
That
Hmm.
is really interesting. And now I'm a little terrified because you're talking about how it's moving to places that it hasn't been. And this is what I'm wondering. And I know that, or I've and I feel stupid for not even necessarily knowing this, but ticks in Manhattan, I never thought about that as being a problem. And
Yes.
I love the idea of, I'm, me with I love the grounding and the martial arts, and I take my shoes off and I'm doing Qigong in the park.
Hmm.
And I spray my feet, but I'm like, you think of ticks as being out in woodsy areas or Long Island or well, we're talking to people all over the world, but speaking from a New York perspective, a place that you wouldn't imagine. So it's happening there now too, which is really
Now, guess what? You know how that's happening? It's happening because of bird migration. And
oh
we
wow.
know that a robin, a cardinal, a blue jay, pick your favorite bird, can carry 10 to 50 ticks. Don't quote me on that number as an entomologist. But when those ticks migrate,
Yeah,
I'm sorry, when the birds migrate, they're dropping those ticks in Central Park or in Chicago or in, San Diego, whatever big city you're
right.
in. Hmm.
That's unbelievable. So I know a lot of this traditional testing is not finding Lyme. I mean, actually, when I was working in the clinic and I did start having symptoms, I did take a test, but because it didn't come back positive, I had two bands that weren't enough to meet the criteria of the CDC for being positive for Lyme disease. So I kind of brushed it off because I didn't have any other signs. I didn't have the tick bite, I didn't have the bullseye rash. But what should people do in terms of testing? Like you know exactly what to do. And it's not just going to, I know people know of IGenics. They have very good PR, so people know about them. But there's many other good things to test. And also for co-infections, and I want to get into that a little bit. Like
Right.
we test.
So, everybody, if you're taking notes or you've already written down, there are many kinds of Lyme. Maybe they haven't found the kind that I have. Number two, have you had symptoms early that were never addressed? And also, everybody, a quick disclaimer. I've had people come to me, they're like, Jerry, you are the one person that's going to tell me I have Lyme disease and give me antibiotics. And I'm actually like, actually, no, you've got a really bizarre case of hypothyroidism. You
Mm,
don't have Lyme disease at all. So everybody, you
wow.
have to always have an open mind, right? We don't want to have tunnel vision of that. But everybody, one of the things I continually teach is the Center for Disease Control Lyme disease criteria. nowhere on there does it say that a blood test is actually required to diagnose Lyme disease. It says you have to have symptoms.
Huh.
You have to have the chance of being exposed to the deer tick, the one with the black legs. You have to have ruled out other disorders. So when a patient comes to me like, oh, I don't have Lyme disease, my test was negative, I actually go to the CDC website. Their long-term persistent symptoms are actually pretty right on. I tell people, look at this list of symptoms. So everybody, if you're out there listening to this podcast, look at the long-term symptoms on the CDC website. If you're clicking a lot of those boxes, that might be an indication to treat because nowhere is a blood test required,
Mm.
right?
So
Number
now when you
one.
say treating, you're talking about antibiotics or beyond antibiotics at this
Or
point.
even, there's actually some Eva Sapie in Connecticut has published good data. Johns Hopkins has published good data on herbs.
Hmm.
Um, also essential oils.
Hmm.
Even some of the research on the West Coast about using antihistamines like desloratadine and Claritin to block the minerals that the germ feeds on. So, but I will tell you, Danielle, I've had a lot of people come to me like, I did this herb, I flew to this country, I got this infusion, I tried this shot, I
Yeah,
spent $500 on this special thing. I'm like, have you ever done $30 worth of doxycycline? Like, no. I'm like, try that first. And
right,
you'd be
right.
surprised. Right.
That's usually like it seems like a first line therapy, but then after that, there's so many other things to test. Like let's fast forward. So someone's diagnosed with Lyme, they do their rounds of antibiotics, and you see this all the time. They still feel like crap 6 months later. So now you're doing more testing because you know the Lyme is still going to be probably be present, or but what else are we testing for?
Right. So, one of the things we know is that on the surface of the Lyme spirochete
Mhm,
are
mhm,
different types of peptides.
mm.
So one of the new markers instead of the ELISA that we typically look at is what's called the VLSE or a C6 peptide. So C6 peptide is actually a very good marker for Lyme disease. And when you do a Western blot, you want to make sure that you list all of the possible bands. For example,
Yeah,
IGeneX, MDL, Stony Brook will list all of the bands, not just the CDC basic required ones. Now, everybody, there's a test called PCR, preliminase chain reaction, which actually looks for the presence of the germ. If the PCR is positive, you definitely have Lyme disease. There's no way out of it. But the problem is because the Lyme germ likes to hide from the immune system, the best PCRs are from body fluid that is not blood. For
mm,
example, like if you have a big swollen knee, we'll put a needle in it and take fluid and send that to the lab. So many patients will say, I want to do a PCR blood test. And I'm like, it's probably not covered by your insurance, and that's going to be really expensive. Now, it is controversial. Well, Danielle, we could do controversy.
of course. Yeah,
Of course, the natural killer cell called CD57,
yeah,
with Raphael Stricker on the West Coast, has done a lot of work on this. And for decades, we've been using it as a marker with complement markers like C3A and C4A.
right.
So,
And that's
anyway,
really interesting, the C4A, because when I first came to you, it was so elevated. And once you started treating me, I watched it come way down and I felt the difference. So I want to talk a little bit about some of the therapies that we use, but I'm just interested in speaking about these other types of diagnostics because a
right.
lot of doctors don't do them at all.
Yeah, so the CD57 can basically be done by almost any lab. There
Uh,
are lots of natural killer cells, but the natural killer cell that you want is the CD57. Now, National Jewish Lab and LabCorp seem to be at the tip of the spear with looking at this number in particular. But everybody, here's the important disclaimer about getting your CD57 checked. it's really hard to look at just one number at a snapshot. We look at how your immune system changes over time,
Mhm.
right? So we could probably do a whole nother podcast on, what we call persisters or resistant form, like cyst and biofilms and L forms and round bodies. But one of the things that I'll do, especially if someone is stuck, they're like, I've tried everything, I've done everything, I've been there, I've tried everything. We may use natural enzymes like lumbrokinase or Cerezymes or serapeptase or Baluchi or something a prescription biofilm like nitazoxanide or Alinea. Everybody listen to this.
Yeah.
If you take one of these persister drugs, either an enzyme or nitazoxanide, and you take this and then you come back and your CD57 goes down, the lower the number can be reflective of more Lyme activity in
Mhm.
your system. Again, there's not a lot of hard data on that, but a lot of experience. Whereas if your CD57 goes up, that's typically a marker that your amount of infection load is going down over time,
Oh,
right? So guess what, Danielle? Here's a great story for you. People have come to me. They're like, Jerry, you're crazy. I'm taking nitazoxanide. I'm doing lumbrokinase. I'm doing Baluchi. Nothing is happening to me. Nothing. I'm like, stick your arm out. I'm going to check your blood test. Wow, your CD57, which was 100, which is good, 60 to 360 is the range. Now your CD57 has gone all the way down to 50. So
Mm.
that means all this treatment you're doing is disrupting some of these persister cells. And almost always, a couple days later or a week or two later, like, oh, I'm really feeling like my CD57 has dropped.
Yeah, I mean, Alinea is such a powerful uh, medication. I mean, it works so well. And I know that for biofilms, people like to use biocidin and some other things, which are very good. But in the very beginning, it was such a game changer for me. And I've spoken to other clients that I've worked with, and their doctors have never mentioned using that before. So I think that's maybe something interesting to speak to their physician about because it could
Right.
be very, very helpful.
And
Wow.
Danielle, what I like to do, remember that story about Jerry, you're crazy, I'm not feeling anything?
Hmm.
One of the ways that what I do with nitazoxanide, everybody,
Nitazoxanide
nitazoxanide
is Alinea.
is
Just
Alinea.
over
Yeah,
here.
sorry. Right. What I do with nitazoxanide, because the Alinea brand doesn't exist anymore.
Oh, okay. I didn't know
It's
that.
so much easier for us to just say Alinea.
Yeah.
But number one, it was originally marketed as an anti-parasitic. Like young girls in the Peace Corps drinking Congo River water would take this, right?
You know, even sorry to interrupt, but even Dr. Klinghardt during COVID, if he was very into, I think, ivermectin, but if you couldn't get ivermectin, he was recommending that because it was so antiviral and worked so well.
Yes, you're right. It's an antiviral, and they actually started marketing. It was called NTX 500, which
Mhm.
was going to be nitazoxanide or Alinea for COVID, right?
Yeah. Mhm.
Right. But what's really interesting is nitazoxanide is the only prescription drug that I know of that actually has an approved indication for resistant H. pylori, for H.
Mhm.
pylori as a biofilm.
Right.
So
That's
it's anti-parasite, antiviral, antimicrobial, anti-cyst, anti-biofilm. Again, if you're in that community, you're feeling lost, alone, and directionless,
yeah.
like this would be something to look at.
And
Now,
also,
again,
I'm sorry, go ahead.
sorry, here's how, again, I do it. Because if this is going to uncover cyst and biofilm, you don't want to be have too big of a die-off reaction. So I tell people start with a low dose for a few days. If you don't feel anything, take a little higher dose. Take a little higher dose after that. So you let nitazoxanide keep peeling away the layers.
Mm.
I bet some people have kind of a big uptick in their Lyme symptoms,
Yeah.
2 or 3 pills. Some people, it's taken 40 to 60 pills. But I tell people once you take nitazoxanide, you need to do at least 40 to 60 pills, 500 milligrams each. And then you already know where this is going. Somebody's like, Jerry, this is terrible. I don't feel good. My face is numb. My knees are swollen. I'm like, get to the lab and do a CD57. We
Uh,
want to document in that moment exactly what's happening to you.
what a bitch this disease is, honestly.
It's
But
insane,
yeah,
right?
yeah, but
Mhm.
thank God there are therapies that help with this. And also some other testing that is really important that you do is you check for Epstein-Barr, you look at cytomegalovirus, you look at the herpes viruses. What do people find out when they're looking at oh, and let me also mention also other co-infections like Bartonella, Babesia, Mycoplasma, like I'm like all these different types of things that are all part of this matrix of Lyme disease, mold.
Right. Yes, exactly. And so when you're thinking of co-infections,
Yeah.
there is a lot of data that Babesia, which is a parasite, it's the cousin of malaria. There's a lot of data that Babesia can actually linger for a really long time.
Mm.
And the Infectious Disease Society of America, the IDSA, actually says for people who are immunocompromised, and again, that could be anything from young college girls with lupus to fragile cancer patients. But
Yeah.
the Infectious Disease Society says if you have Babesia, you need at least 6 weeks of treatment. Wow.
Yeah, wow. That's right.
And then they actually documented that um, it can relapse even after 6 weeks and need another 6 weeks of treatment. Um, Actually, August of 2023, this was published, and it was kind of a big deal because people like giving people 6 weeks of an antibiotic with a refill. I'm like, yeah, that's what the published data is
Yeah.
actually showing. Now,
Wow.
Babesia needs an antibiotic and an anti-malarial to really be able to conquer that. So.
And now one thing that you were using early on that people it's kind of trending now is this new drug, but you've been using it forever. Low dose naltrexone. I know you love this
Yes,
one. So let's
exactly. Right. Everybody write this down. The group that I work with is called the LDN Trust, the Low Dose Naltrexone Trust. It's the ultimate resource page for everything in the world of naltrexone. So most of you, if you think of naltrexone, you think of Narcan, you think of drug abusers, people with chronic alcohol addiction. But they've done studies even back in the 1980s. There's a study on why would um, Upper West Side homosexual men who were drinkers and overweight and out of shape, why were they surviving HIV and the thin triathlete guys were dying of HIV? One of the things they found is that those guys that were overweight drinkers and smokers and not exercising um, for their alcohol problem were on naltrexone.
wow.
And that was mitigating some of this HIV. And then Hershey, I think it was Hershey University, probably about 15 years ago, published on the use of naltrexone with certain types of cancers.
Hmm.
What I like to think of naltrexone as being is it really helps to re-regulate that immune system.
It
And
does.
everybody,
And also
sorry,
mast cell activation syndrome. Do you see many people that have Lyme that don't have MCAS?
I mean, almost everybody with Lyme is going to have some kind of mast cell activation.
Yeah.
Tie in a little bit of alpha gal, you tie in a little bit of SIBO, small
Mhm.
intestine bacteria, or CFO,
Yeah.
small fungal bacteria. And yeah, that's setting off mast cells like crazy. By the way, people, there are lots of really good stool testings out there, which will run you a couple of $100. But I usually start with a simple Quest or LabCorp stool test, which will give us 10, 15 good points of data covered by your insurance. So,
Oh yeah, absolutely. The gut microbiome is so important, and also so many neurological issues stem from having these diseases. So If the gut
Right.
fix the gut, the brain starts to feel better. And also for mast cell activation syndrome, you're working with antihistamines besides doing a low histamine diet, but also ketotifen is something that you work with that's been phenomenal for so many people, which is a
Right.
pain blocker.
Yeah. So what's interesting about ketotifen is it is an antihistamine, but it's also a mast cell stabilizer.
Yeah.
We think of something like cromolyn, which is really just a mast cell stabilizer. Now, almost every tissue in our body has some kind of mast cell, but most of them are in the gut.
Mm,
So, in the world of mast cell, in addition to doing the diets like you teach people about, the
right.
ketotifen with pepsid, famotidine, is that double combination of the famotidine with ketotifen is a good combination to really keep mast cell in check. Again, with diet, lifestyle, things like that.
Right. And one thing I want to mention about Jerry is even though we're talking about different drugs and therapeutics and things like that, he's very into nervous system regulation. And I have to mention that you are one of the first people, like now the thing that's trending like crazy are vibration plates.
Yes.
Who was first a vibration plate?
5 years ago, the
Oh my
vibration
God.
plate.
I got my
Right.
first vibration plate 5 years ago because of you.
Yes.
And like, so I've been doing that. Vagus nerve stimulation for the nervous system. Who was talking about it? And you
Yeah. It's
and
on my YouTube page. Check it
your
out.
YouTube
Right.
page and your hack with the TENS unit. Jerry
Yeah.
uses a TENS unit on the belly. You should go to his YouTube and he shows you how to stimulate your vagus nerve for like $30 instead of getting an
Yes.
expensive device.
Hmm.
Amazing. So I
Right.
want to ask your opinion on this because how much do you think nervous system, downregulating the nervous system has to do with healing in conjunction with doing all these therapies?
Right. Part of that, right? If we're focusing on all of you, you know who you are out there. We're focusing on all of you. You're lost, alone, and directionless. When you don't feel good,
Yeah.
that's obviously upsetting. And how many of your family like don't always really know exactly like what's going on? You know what
Totally.
I mean?
And they have the best
So,
intentions, but I always say like you don't get it until you get it. Like
right.
the magnitude of how messed up this this disease is, like no one can actually understand unless they've experienced it or they have like a loved one and they've watched them go through this trauma.
Right, exactly. And one of the newest things that this is going to be a big revolution, but you
Mhm.
heard it here first, is one of the companies I also use a lot of their products, Des Bio, has what's called a mental emotional detox kit, which works, as thinking of acupuncture. I'm not an acupuncturist,
Uh-huh.
but they talk about miasms and chi and kidney and liver flow,
Yeah.
um, working in conjunction with vagus nerve mind, but also that whole emotional component. So for people that are, to put something really hard, simple, kind of like completely derailed, like that mental emotional kit is one of the things that I've been working in addition to, vagus nerve and tapping and deep breathing and, focusing on positivity, journaling, all of those things. That's one little piece that just over the last couple weeks I've been having some very good outcomes with.
That's terrific. Yeah, for me, the nervous system work is has been so huge. I mean, obviously you need to know what you're dealing with. You have to go after the infection. And that's what I try to tell people when they see me do so much Tai Chi and Qigong and I say how it helps me to feel so well. And I'm like, don't think that I haven't gone after the infection. I'm not treating it. I don't think my diet's not good. Don't think I'm not working on my gut. We're doing phaging. Jerry has me doing
Yes.
something called phaging, which we're going to wrap up soon, but I think it's interesting to mention because can you explain what phaging is? Because I feel like it's going to be hot, like you're always 5 years ahead of the curve. So if you can tell people.
Yes, exactly. So basically, a phage is basically using either one bacteria or a virus to go after another. So, like scientifically, if you're out there and you're like in bio 300, like in college, we think of what are called bacteriophages, right? Are viruses that will basically get into bacteria. But my idea of phaging is taking strains of what I call them, attack probiotics
Hmm.
to kind of replace that SIBO and SIFO in the gut, right? So we can use, oil of clove and cinnamon, and we can use prescription rifaximin or vancomycin or teasel or ginger or oregano. There are so many different ways to kill bad germs in the gut.
Hmm.
My theory is using other germs to kill the bad germs, and that will then bring in the new ones to help to replace them. So there's a
Amazing.
lot of like people with a really weak immune system or severe autoimmunity should not do phaging. But for many people, especially if their gut just doesn't seem to be clicking, like you're going to hear about it more and more and more about phaging, especially as big pharma hears about it and they get away from synthetic chemicals and are using natural microbes in our environment to kill other microbes,
With
bad ones.
aging for me, my experience has been that it's helped my brain. So I feel like it's just like a little clearer. And the gut brain connection for those who are listening. So if you start to work on your microbiome by doing stuff like this, it's really helpful.
And Danielle, would you say that when you started phaging, it was something you noticed like right away or it took time?
So I had two things going on. I'm like, my brain feels better, my stomach hurts. Like it's I had side effects in the beginning. It wasn't just like, oh, let me do the phage. And it was like because it was bringing up old stuff, like we were talking about. I had some burning, to be honest, on my stomach, and I hadn't had this pain that I hadn't experienced in years. And I was like, what is that? Then it finally left, and I went back to the phaging, and I definitely think it's very good for the brain. So it's something that I've been cycling through, and I like it, but I definitely think it's going to become popular.
Right. So, everybody, what we're talking about, in case you're losing track, is companies make probiotics in what are called a phage form. So, you're doing a particular type of phage probiotic. It's not a prescription, it's over the counter.
Right.
I usually encourage people not to do this on your own because phaging does not work well with other probiotics. And it has to be done in a pulsing way. Like, just don't start phaging right after this on your own. Your gut
Right,
might not
right,
be too happy, right?
right. So speaking of not doing it on your own, so I don't even know if you're taking on new patients because for years you were so busy that you weren't even seeing anybody new. Are you taking patients now?
Sometimes we can get in our referral network, we'll get a few patients in, but like if you go to our website, like it's we have
Dr. Morrison's office, are you referring
yes.
to?
There are other practitioners that I work with, so people that want to get in our community
Yeah.
and get their CD57, get their MDL, get their IGenics, their micro DX urine test, or, so they can get in our community and get all of this going. And we all work with each other in the office, so if we have questions, we all help each other out.
So Jerry's with the Morrison Center in New York City, but you're also in East Hampton.
Well, we're in
Oh,
Southampton.
Southampton.
Dr. Morrison has an office with, it's called Hampton's Biomed,
Right.
right in Southampton Village. So I see patients in both areas, and we have practitioners that do this and understand a lot of this in both areas also.
Great. And if people want to just learn more about you, read about you, I know you're on Instagram and you're involved on LinkedIn and all of that, but do you have a website, or where's the best way people can learn more about your philosophies if they can't get an appointment with you?
Yeah, so I have some articles on morrisonhealth.com, and I have a bunch of community, like a 90-minute lectures on all of this on YouTube and linked to my YouTube page. And I'm always throwing out fun facts on Instagram or new studies or treatment ideas, things like that.
Your YouTube is Jerry Simon, Gerald, with a Gerald or Jerry?
With a J, Jerry.
Okay, Jerry Simons. Great. Thank you so much for taking the time. I know how busy you are, but I feel like you gave us so much good information.
I love it. We'll see you next time.